Nothing can really prepare you for the heartbreaking reality of a neonatal intensive care unit. It's a place expectant parents hope and pray they'll never need. But if your baby is premature or sick, you wouldn't want to be anywhere else.
The stress of watching your baby hooked up to high-tech machines can play havoc with mum's breast milk supplies, and that's where the Mercy Hospital has stepped in to establish a breast milk bank.
Having a baby is undoubtedly one of the most precious times in your life, and we all, of course, want the absolute best for our children in every way. For a variety of reasons, breast milk and feeding doesn't always come easily for every new mum, and they need all the support they can get. In the coming months, the Mercy Breastmilk Bank will begin providing the best possible alternative nutrition to premature or sick babies whose mothers can't provide breast milk for their own babies.
There's a need for a breast milk bank because not every mother is able to provide sufficient milk for her own baby. Where it becomes incredibly important is in the field that I work in, which is with very small, very premature and very sick babies. And for those babies, breast milk is much easier to digest. It has a whole lot of extra immunocompetent factors in it that we just can't substitute with formula.
Well, Sue, tell me about your story with Hudson.
When he was born, he was really sick. We found out he'd had a stroke on the left side of his brain.
Wow.
So he was in ICU and he was attached to a lot of tubes and things. So I had to express straight away. So yeah, he literally wasn't physically fed from me till about day 7.
So why have you decided then to donate to the breast milk bank?
Well, partly it's because I have a surplus of milk, which has now, I will increase my supply again for the breast milk bank. But when we're in here, it's such a stressful place to be because your baby is unwell and you know that you can't do anything for your baby. You just have to watch helplessly. So I'm trying to, I suppose, give breast milk to just take the mums particularly and the babies that feel that they really want to feed and yet they can't do it because for whatever reason they can't supply it. It's just another thing that you don't want them to have to suffer any more than they're already suffering.
The difference that we think it will make to them for our very small babies will mean that they'll actually tolerate the milk better. They often don't actually absorb the formula particularly well. It takes them longer to get established on their feeds. So we'll see that sort of difference in that they'll start feeding sooner. They won't need to have intravenous drips in to give them intravenous parenteral nutrition because they'll just be able to take the milk straight into their intestinal system. Yep. For our very small babies, there's a particular condition called necrotizing enterocolitis. It's like a really, really bad gastro, and that's understating it. We know that from studies that babies who are fed on breast milk have 6 times less incidence of that terrible condition, not to mention less infection, because of the infection fighting capacities of mother's milk. So that all should add up to shorter stays in our intensive care unit, babies home sooner with their families, which is where they're supposed to be. I think the most important thing to understand is that we don't want to replace mother's own milk with the breast milk bank. This is just a little addition, a little top up, a little top up for when they need a little bit of help.
Yeah, we've both been in there with kids, haven't we? It's not a pleasant place to be, the intensive care unit.
And that is a hell of an idea.
Isn't it just great?
Yeah.
It does. It warms the cockles of your heart. It's really important. And if you'd like to find out more about the Breast Milk Bank and how you can help, head to its website or call the number on the screen now. Time to check with Marianne.